proceed to the first slide, which is the definition basic labor hour. What is basic labor hour? This basic labor hour for the purpose productivity management, which typically based on the full-time equivalent, which is FTE matrix. Usually, productivity is measured by the amount of the output per employee or per labor hour. On this slide, I will explain about full-time equivalent, also known as FTE. First and foremost, what is FTE? FTE is a unit of measurement equivalent to an individual. Individual can be anyone. It also can be anybody. It can be worker or student or one of work or school day. Usually, this is applicable in a variety of contexts. But in most cases, FTE usually measures on employees. This also because to ensure whether they work followed by basic labor hour or not, or we can simplify as a overtime. FTE employee could also change based on time period being considered. Actually, FTE are mostly used by companies because this is critical for accounting purpose, their financial, to determine wage and also for calculating the company's expenses when they pay the workers. Next, it is important to differentiate between the types of labor hours. There are two types of labor hours. What you can see from the slide, we have productive hours and also non-productive hours. Now we go through at the first type of labor hour, which productive hour. Productive hour, which the time during which an employee is required to be on duty where on the employer's premise or at a prescribed workplace and inactive productive labor. These productive hours can be controlled by the management and used to directly provide patient care. This is also including the regular paid hours, overtime and callback hours, and hours paid for training or orientation. In hospital, it is including delivery of patient care or facilitate the delivery of patient care. For the second type of labor hour is non-productive hour. Non-productive hour include all paid off-duty hours such as vacation or holiday days, sick leave, staff development, training on new equipment, and idle time. Normally, it is paid to employees who are not engaged in their normal work. Before we go through, I would like to explain about idle time that I have mentioned in previous slide. First and foremost, idle time is ready, but it is not doing anything productive, or we can say as a waiting time. For information, idle time is one of the highest concern in hospital. Here, I will provide the example of idle time. What you can see from the slide, this is some example of idle time which the clinician is not working nor is the patient getting treatment, but the hospital is still incurring a cost for these activities. This is also include redundant activities such as clinician waiting someone who may know more or expert about specific tool or engage in busy work. For information, output may vary depending on the type of organization involved. But in hospital, the normal unit of service is the patient day, which represents one patient in one hospital bed for one day. Alright, for this topic, I have done some research, and from what you can see, it is news from the Star, which online news. In this news, they have mentioned about the Malaysian Employment Act 1955. They state that a work week as 48 hours with a maximum of 8 hours a day and 6 working days a week, and also will be provided 10 days of paid holidays. So if the worker work more than this, it is classified as an overtime. On the next slide about issues in hospital regarding labor hour, or we call it as on-call. This on-call system can make a doctor work for 33 hours continuously non-stop. This one of the system currently practiced in hospital is the on-call system, where an officer had to be ready to work after hours. Here I will give you some example. Basically, a doctor working hours are from 8 in the morning to 5 in the evening, but the on-call system can be said to be sort of overtime, which means we can see here Normally, doctor will work for 9 hours, but because of on-call system, they have worked more than that. Doctors who have been on call include medical officers, clinical specialists, and as well as medical consultant. Now we proceed with the issues, which the first one is shortage of specialists. For information, Malaysia also face this kind of problem, and then this article I've got from the website which Lab New Asia. They have mentioned that we are still lacking in terms of specialists and need to manage and train about 500 to 600 doctors in expert in a year. Second, shortage of nurses and trained healthcare professionals. This incident also will contribute idle time that I have mentioned before. We lack of someone that expert in certain things. And the last one is lack of physician highly skilled. If this case is not addressed, the patient will become overcrowded. This is due to their inability to act appropriately. Any example related to these issues is current situation, which COVID-19 that we have faced now. This incident, what we can see, the demand of physician become higher until they accept the volunteer to come and join to help the physician to settle down the higher level of patient. And the important part, these three issues that I have mentioned before can contribute on call system, because it is according to Malaysia Ministry of Health, one of the reasons why a doctor had to do more on calls, because the number of practicing doctors in Malaysia is not enough. They can't to support the number of patients that will become day by day, the patient will be overloaded. Next, what you can see from this slide, this is statement that I have mentioned before on previous slide about on-call system that make a doctor work 33 hours continuously, and then this statement based on Ministry of Health. Okay, if I'm not mistaken, I've got this article from Sinar Harian. So that's all about basic labor hour management. Thank you for your time. Have a nice day. Stay safe. Stay healthy.